Okay, so this is just the basic setup of what we need to fit and adjust an NTI. Just got something to put boiling hot water in, a cup of cold water to help the thermoplastic bead set, spatula, straight handpiece, your NTI and your thermoplastic beads. Okay. So what we want to do is just try the NTI in place. Normally I like to make it on the lowest because it's just much easier to make. I'm just going to ask the patient to close together. What I'm going to ask you to do is slide far as you can left and the other way, back to the middle, far as you can forward, far as you can back, and open. And what you're doing is you're just making sure that patient's not hitting any teeth towards the back, and we're absolutely fine. When we end up fitting the NTI, you want to make it central, and you want to try to make it nice and flat to the upper occlusal plane just for ease of adjustment. Okay. Now what you're going to see is you've got these big heels on the NTIs. We don't need those, so the first thing that we're going to do is adjust those back to make life nice and easy for ourselves. Okay, so what we're going to do is we're going to get rid of this excess plastic at the bottom here and at the back of the NTI there as well. And you can take that nice and thin. And see what we've done is just removed it from the back and from the front there. So that's for two reasons. That's for comfort for the patients and so that they can't lift it off with their tongue and with their lip. So what we're going to do now is we're going to line the inside of this using thermoplastic beads. Okay, so what we've got is about a teaspoon and a half worth of thermoplastic beads, and we're just going to pour freshly boiled water on top of them. When you start with the thermoplastic beads, they're this white colour, and once they've actually softened, they go a clear. That's not quite gone yet, but you're watching another few seconds, that will have gone completely clear. Just like that. I'm going to take off the excess and just start moulding it around. It's very easy to mould. It's fairly warm, but it's not red hot that you can't touch it. Obviously just judge the heat of it before you put it in the patient's mouth. Just warm them, it's going to be a little bit warm like a cup of tea or coffee. And what we want to do, just pop some on the inside. And now we're going to transfer this to the mouth. So normally I try to stand in front of the patient when I'm doing this. What I want to do is centre it on the lower ones and just push it down. Any excess that comes over the sides you can just adapt to around the adjacent teeth and around to the back of the NTI, and you want to be fairly central. We then look from this aspect and we make sure that the discluding element of the NTI is just about parallel to the upper occlusal plane, which it is. What we can do at this stage, I'm just going to hit it for a few seconds, just so that it's with the triple air syringe, just so that it starts to settle a little bit. I'll need to slide that on a bit more. So just relax your lip for me slightly. What we're going to do, just a little bit of air. Just until the thermoplastic starts to set. What we can do is, at this stage, you can wait for it to settle a little bit more, or you can take it out very carefully and just pop it into some cold water. If you take it out, try not to wiggle it out because the inside's still going to be a little bit soft. You just want to lift it straight up, and that's exactly what we're going to do. Just going to drop that into cold water. Good. So when you retrieve the NTI out, it's all gone white again on the inside. That means that it's fully set. Before we put it back into the patient's mouth, quite often you find it's just on the labial aspect. You tend to get a little bit of an undercut, and if you don't adjust that back, it can be very sore to the patient, and all of this excess we don't need as well. Some people like to take it off with a scalpel. Obviously, need to be careful if you do that. Other people, like myself, I just use a straight handpiece and a burr. If you apply too much pressure to this, to the thermoplastic beads, then what ends up happening is the friction causes it to melt and it gums up your burrs very fast. So you just want very light pressure, and we're just going to use a straight handpiece just to adjust that now. So just going to ease off the just a bit of this labial flange first, just to make it comfortable to the soft tissues. Then we can trim the majority of this lingual flange all the way. And what we want to do is just blend the profile of the NTI into the thermoplastic bead, just so it's nice and comfortable for your patients, because otherwise they'll pick up any sharp corners. The retention of the NTI is based upon the cervical fit around the teeth. It doesn't actually involve the interdental aspects as well. So the sharp little interdental flashes, the way that I like to get rid of those is just use a scalpel to ease those back and pull it out with a pair of tweezers. So you're just tidying up these interdentals. It takes a couple of seconds to pick it out, make it all nice and clean, and that's ready to try in the patient's mouth. Okay, so now just going to transfer that back to the patient's mouth. Sometimes you hear it click in place and other times it doesn't. All we want to do is ask the patient just to try and lift that out with your tongue. Try and lift it out with your tongue and your lip, and a combination of your tongue and lip. And you tell them, if they can take it out with their tongue or their lip, then you need to reline it, and you get them to do that test every single night. The night that they can take it out with their tongue or their lip, they don't wear it, it just needs relining. If it comes back to this stage and they can take it out, you can just reline it really easily. All that you do is you melt some more thermoplastic beads and you pop this in the hot water bath literally for 2 seconds, and you add one bead into the incisal edge of each of the teeth and sit it down, and normally that just improves the retention quite significantly, and you reline it the exact same way. So what we're going to do is you ask your patient to run their lip and their tongue over it, just to let me know if you can feel anything rough. Okay. And then what we want to do, just close together for me. Push your bottom jaw far as you can forward. And what I'm doing is I'm looking from the back here, and there's a huge amount of plastic that the patient is just never going to get to. Pull your bottom jaw back far as you can. Pull it back far as you can. And at the front, we're just about okay. So what we're going to do is we're just going to, just open for me now, just open. What we're going to do is, where he's never going to hit all that at the back, we may as well get rid of it just for patient comfort. And I could see from looking in the mouth, I can take about 3 millimeters off that. So what we're going to do now, just take about 3 millimeters off the back, because the patient's never going to touch that. And just profile it all back in. So what we do is you ask the patient to close together and slide far as you can forward and far as you can back. And you want to make sure that that transition going forwards and backwards backwards is really nice and smooth. If you see the mandible snaking around like this, is you can put some articulating paper in there and get the patient to slide forwards and backwards, and what you should see is just number 11s where the patient's movement is really nice and smooth. If you see it snaking around like that, you can start to adjust it so that it is moving forwards and backwards quite nicely. So what you want to do is back to the middle for me and slide far as you can left and far as you can right and back to the middle. And all of these movements in all excursions, they should all be really nice and smooth. What sometimes happens is, particularly if the patient comes off the discluding element, off the centrals onto the laterals, as they go back, you can get a little skip or a jog, and at that point you can take an impression of the upper and make an Essex to act as a slider, or you can just do some adjustment to this. I like making sliders simply because they help keep everything, all the transitions nice and smooth. Now, this NTI actually needs very little adjustment, and we know that when we're moving forwards, back, left and right, that it's all nice and smooth. So what we want to do now, and this is a big thing that a lot of people forget, is close together for me, Neil. Push your bottom jaw forward far as you can, and clench together hard as you can. Are you feeling any pain anywhere? Okay. If the patient reports pain, quite often it's just here. That doesn't mean that they've got a jaw joint derangement. What that means is you've over-rotated the condyles and you need to reduce the height of the vertical. So what you're doing is on that extreme movement, you see exactly where they're touching, and quite often what you do is you just round it off so you're dropping the vertical. Put it back in, try it again, and it'll get to the point where the patient turns around and says, well, actually, that's comfortable. And you do that on all excursive movements. So pull your bottom jaw back as far as you can. Clench together hard as you can there. Any pain there at all?
No.
No. Back to the middle for me. Over to the left, far as you can. Squeeze, squeeze, squeeze. Any pain there? No. Over to the right, far as you can. Squeeze, squeeze, squeeze. Any pain there at all?
No.
No. Back to the middle for me. So that one actually needs very little adjustment. Quite often what you'll find is, we're open quite a bit at the back for Neil, but that's just how his teeth meet together. As long as the canines backwards aren't touching and it only needs to be a fraction of a millimetre, NTI is going to work. Quite often what happens is once the patient's been fitted, they'll go away, then they'll come back after a few weeks reporting that pains are coming back, and that's very frequently as the muscles are relaxing, you get an increase in mandibular movement, and all of a sudden they start touching things that they weren't touching before. My typical review protocol is in 4 weeks' time to see how they're getting on, although the patient can call me sooner if they're experiencing pain. And if they're still having issues, then you can look at polishing, refining, reducing the vertical again to get that all nice and smooth.